Hey, I'm Eric, and I'll be explaining about MRSA, risk from contaminated surfaces. First, MRSA, which is often said as MSRA, is a type of bacteria that is immune to antibiotics, which often leads to more problems of controlling it, especially when it causes infections on the body. There are many ways of getting into contact with MSRA, such as body contact in sports, handheld equipment such as TV remotes, headphones, cell phones, contacting services such as toilet seats, hospital beds, and blood pressure cuffs. You can even catch it from animals, especially domestic pets. You must remember that MSRA is only found on people and animals. It is not normally found in an environment such as soil and lakes. So that means the only way for you to be in risk of MSRA is to actually touch any surface or skin that has been infected by a MSRA carrier. Now, just because you touch an infected area does not mean you are automatically infected. It really depends on how healthy and hygienic you are. For example, if you have a cut or scrape, obviously the MSRA, as well as any other well-known bacteria, is going to infect it if not properly taken care of. Taking showers and washing your hands on a daily basis can also reduce the risk of contracting MSRA, as well as barriers such as gloves and towels, which puts a layer between your skin and the infected area. However, if you're in a hospital or healthcare setting, you are more at risk of infection since it is a place where healthcare work employees and patients, and they're more exposed to all these sorts of bacteria. And if they're not careful with where they touch, keep track of what they touch, and not do anything about it, you can contract that infection unaware, since you can't really see it, right? The problem about MSRA bacteria is that if you do contract it, you probably won't even notice you have it. Your body might even overcome it without you noticing any symptoms of it prior to you contracting it. Usually symptoms show up anywhere from 1 to 10 days after you contract it. You expect to see some sort of unusual discoloration on your skin, or blood problems that occur internally. You might feel ill, pimples might break out. It's really hard to tell. But if it is a serious condition, see a doctor immediately. Now, just because you overcome it or had it treated does not mean you will not contract it again. So, to reduce the MSRA risk, I would advise you to have a good hygienic habit and be aware of where you touch before you rub in your eyes or your mouth. These are the easy ways of reducing the risk of MSRA from contaminated surfaces.